Awesome. I think we can go ahead and get started. Hi, everyone. Thank you so much for joining us today for our webinar on development of a smartphone type 2 diabetes self-management app in the South Asian community. My name is Jeevan Sangha. I'm a leader with the Health System Improvement team at the Council here. I will be your host and moderator today, and I'm extremely grateful to be joining you from the ancestral, traditional, and unceded territory of the Coast Salish people, including the territories of the Kwantlen, Samiamu, Tsawwassen, Katsi, Coquitlam, and Stalo nations. Feel free to say hello in the chat, introduce yourselves, and let us know where you guys are all joining from. Before we begin today, I want to remind everyone that this session will be recorded, so it can be accessed later on the Type 2 Diabetes Network website. We ask that we do not share any personable, identifiable information about patients, colleagues, or yourself. The chat will not be a part of the recording posted to the website. If you have your video on, there is a chance that you will be part of the recording, so please turn off your video if this isn't comfortable for you. In terms of our agenda for today, we have an amazing session ahead of us, so I invite everyone to really be present and engage in the session. If you have any questions or comments during the presentation at all, please feel free to pop them into the chat box and we will get to them during the Q&A portion of the session. All right, let's jump right in. It's my pleasure to introduce Patrick McGowan. Patrick is a professor with the School of Public Health and School Social Policy at the University of Victoria. His research career over the last 30 years has focused on aspects of health education for persons experiencing chronic health conditions. He's been implementing and researching the effectiveness of self-management interventions for chronic health conditions. This research is being conducted at the community, provincial, national, and international levels. Patrick participates on provincial, federal, and international committees, and he's based in Delta, BC, where he directs the Institute on Aging and Lifelong Health Ladner office. Joining Patrick will be Gundeep Sidhu, the South Asian Program Coordinator with the Institute on Aging and Lifelong Health at the University of Victoria. Gundeep provides support to the participants in the app download, in the follow-up calls, ongoing weekly meetings with participants, and she provides information about other Punjabi diabetes self-management programs as well. Lastly, Krista Lam will be hosting and facilitating the Q&A portion of the webinar today for us. Krista is a writer, communications professional, and podcast producer and host. As the director of Krista Lam Communications, she specializes in helping translate complex medical, scientific, and health-related topics into interesting and understandable stories for diverse mediums. And we're thrilled to have her here today to join us. I would now like to welcome Patrick and Gundeep. Over to you.
Good day, everyone. I'm here to tell you about this really neat project that we've been involved in the last couple of years in developing a smartphone app for type 2 diabetes. Okay, now, first of all, I'm going to tell you about the rationale for implementing this program, the reason why. Okay, just put this over here a bit. Okay, can you move this out here? Yeah. Thank you. Okay, so we've been implementing self-management programs for chronic health conditions, particularly diabetes in British Columbia, for about 30 years. Okay, and we started working in the Punjabi community, in the South Asian community, in 2009, and we piloted and got implemented two self-management programs. One chronic condition self-management program, and the second one, a diabetes self-management program. Then between 2010 and 2020, we took those programs and implemented in different parts of British Columbia, Nanaimo, Richmond, Vancouver, Victoria, Abbotsford, Prince George, Surrey, Penticton, Port Alberni, and whatnot. And that was really good. But in essence in these programs is that they are in-person programs, in-person small group. By small group, I mean 10, 12 people, but in person. And all of a sudden, 2020, COVID comes along. And so all of a sudden, we weren't able to implement the programs. So we actually developed 3 different programs. And one is called the Punjabi Diabetes Toolkit Program, the Punjabi Diabetes Toolkit and Calls Program, and the Punjabi Type 2 Diabetes Smartphone app. And that's the one I'm going to talk about today. Okay, so the way that the programs worked is we would recruit community members with chronic conditions, and these would be South Asian people who had chronic health conditions. And then we would provide a 4-day training for these volunteers to learn how to lead our program. And then we would arrange group sizes and locations between 10 and 16 people in different locations. And over the years, we probably involved 3,500 persons with type 2 diabetes. And then pairs of the trained leaders would deliver the programs, okay, 2.5 hours a week for 6 consecutive weeks. And we had trained 459 of those leaders to lead the program, okay? And this is like part of the process. Recruiting people was really easy then. Newspaper ads, posters in the temples, in the churches, in the malls, libraries, whatnot. Everything worked, okay? And at that time when we started, we actually were only able to provide the training in English. So anybody who wanted to become a leader had to be bilingual. That means that they would speak the Punjabi language and English. And here's an example of a leader training workshop just completing. And you see there's several members of the Punjabi community as well as other communities. Okay. When leaders lead the program, they follow a scripted manual, the Diabetes Self-Management Program Leader Manual, and we translated that manual into Punjabi. So the leaders were able to use in the Punjabi version. Okay. People who would take the program would receive one of these 2 books. Okay. And this is just reading, background reading, because people wanted to know more about things. Okay. One was just a general book on living a healthy life with chronic health conditions. And the second book, if the person was experiencing pain, that was the main concern as well, it'd be living a healthy life with chronic pain. So here's an example of a trained leader. And the trained leader, there's actually 2 people there, leaders. They would lead a group to 10, 16 people. And they'd be, before we started, I should say this on the side, before we started, it was all the concerns, oh no, only women can lead women's programs, only men can lead men's program. But in our whole experience in the community, we never experienced this, okay? People didn't matter if you were male or female, okay? In the programs, there's a lot of opportunity for small intersection as well. We had people actually discussing things. Here's one of the leaders at the break explaining the process of making an action plan. And some communities really embrace the program. Like this is a picture from all over British Columbia where 30 people at once wanted to become trained. It's just, there was such good community interest, okay? Now, later on, we introduced the Diabetes Self-Management Program, okay? And it was quite an event and we had lots of community support. That's really integral to a program like this. You had to have the community organizations supporting and talking about it, okay? And even in the opening description of the program, about 90 people from the community came to listen to it about what the program is about and how to get involved, okay? Even over the years, there was interest in people who had experienced gestational diabetes during pregnancy, just as a preventive measure so they wouldn't develop type 2 diabetes later on in their life. And we even provided education to the diabetes educators in the diabetes education centers that serve the South Asian community. Okay. Now, after COVID, all that good work had to stop because we didn't have any person contact. So we developed 3 programs. One is the Punjabi Type 2 Diabetes Toolkit, the second one, Toolkit and Calls program, and the third one, the app, which I'm going to spend more time on. But with the Type 2 Diabetes program, it's a self-test. People use this program by themselves. They score themselves on their fatigue level, worries, their tests that they're taking, and then they receive some education. We translated the book into Punjabi, and as the accompanying reading, we've included the On the Road with Diabetes Health. That's the standard patient education booklet in the Fraser Health and Providence Healthcare. And in the toolkit program, people learn self-management skills like the action planning, problem solving, decision making, and they also learn the standard diabetes education things. Okay. Now, when we started developing the steps for the app, the diabetes app, the first thing we did was We developed an industry partner, and that was a Yoga Health. They had received citations for doing such good work in health, and they had also developed an app a couple of years ago that was used in England. We did a literature review, a massive literature review, and there's thousands and thousands of articles written on apps, but most of them are by industry, and most of them were just measuring blood sugar levels. Okay. The recommendations were that you shouldn't have an app unless it provided patient education material and it had a behavioral component as well, a behavior change strategy, like a theoretical program. Okay. So from there, we had conducted 4 community meetings, focus group meetings involving 59 seniors with type 2 diabetes. And the questions were like, if there was an app, what should be on the app? How do you use the app, whatnot? Okay. Then there was a process of writing up the app content. We wanted to keep it basic, not overwhelming. We wanted people to understand and not be turned off by it. Then there was translating the content into Punjabi and then recording the content into Punjabi as well, because on this app, you could either read it or turn it on and it would talk to you. Okay. Then there was taking all the photographs that would go in the app. The first user test involved about, I think, 10 people. We asked people to use the app for a period of a week, and then we called them back and had a whole bunch of questions for them about what they did, and, you know, what difficulty they have, which section to go to, whatnot. Then we were developing an evaluation for the app, and that depended on in-person self-management programs yet. So it was hard for us to actually complete this evaluation. So it's still in the process of being developed. And then the last step is we found a home for the app. The app has moved to University of Victoria and is being maintained University of Victoria. And as far as capacity is concerned, they tell me that if 50,000 people are using the app at once, that shouldn't be a problem. Maybe if 100,000 people are using the app at once, maybe there would be a potential for a crash, but they could fix that easily. Okay. So now, remember I said there had to be a theoretical flow, theoretical orientation to it. So during the app onload, during the setup, the user selects problems that he or she wants to work on related to diabetes. The user completes a short self-efficacy questionnaire in managing diabetes. Then the app sends educational content based on the problem selected. Subsequently, users learn how to use a problem-solving process, how to make behavioral action plans, and how to make difficult decisions. And on a daily basis for the remainder of the week, the app sends specific education-related materials to the person identified. After 1 week, the app checks in with the user to see if they completed the action plan. If the user completed the action plan, he or she was congratulated and offered to work on another area. If the user was able to complete the action plan, the problem-solving process would be used and people would be able to identify ways that they could deal with their plan. Then the user makes a new action plan. Okay. So from there, I'm going to turn it over to Gundeep, who's going to tell you about the process of people setting up the app on their phones.
Thank you, Patrick. And now I will be talking about how this app program works. And anyone who register themselves for this program, they receive free app, which is Yogo T2D app and free Punjabi 2020 edition of On the Road to Diabetes Health Patient Booklet, and they receive 3 follow-up calls by the coordinator in the first month. And there are ongoing weekly telephone group meetings. Family members can also join those group meetings. And funding to provide this program to the public is provided by Ministry of Health Patient as Partner Initiative. And before we decide who can download the app, there are certain requirements. They need to have a latest smartphone. So there are certain compatibility requirements, as well as they need to have an email address, which they can open on their phone. And the steps for installing the diabetes app is you have to go to Google Play Store or Apple Play Store, and you have to type Yogo T2D in the search option. When you see it, then you have to click download. After downloading, you will see this page on your phone, then there are two options, sign up or log in. For the first time, you will click on sign up to create an account. Then this will open this page and you have to enter your email. Then you will create a password for your account, and then there is an enrollment code which will be provided by the coordinator from the University of Victoria. And when you click next, so it will send the confirmation email to your email. So once the email is sent, you have to open your email account and you have to click on the link sent in that mail. And when you click on that link, this will lead to this page and it will say login. Then you have to re-enter your email and password and you will press next. This will automatically save your login information. And just in case you are vulnerable to forget this information, you might prefer to write them down. Then you will enter your first name, last name, email address, password, and the date when you were diagnosed with diabetes for the first time. And then you will select a problem to work on and you will turn the notification on to allow for daily notifications. So this whole process will set an account for you and the screen will say your name and you have home, action planning, settings, and help. So next, after completing the account setup, it will lead to you different educational presentation. So there are 16 different topics which you can choose daily to work on and to select a problem solving process. These topics include what is type 2 diabetes. Second is blood glucose monitoring. Third is medication. Fourth is test. Fifth is healthy eating. Sixth is physical activity. Seventh is sleep. Eighth is stress management. Ninth is medical appointments. 10th is food problem. 11 is sick days and diabetes. 12 is traveling and diabetes. 13 is problem solving. 14 is action planning. 15 is making a difficult decision. And 16 is more. So these are a range of topics that are included in the app. And you can choose from these topics to have more information and to make your action plan on these. After selecting the topic, there comes self-efficacy quiz. So it's a scale from 1 to 5 where the participant can answer on that scale and know about where his score is. And the questions include, is it difficult for the participant to find effective solution for the problems that might occur with managing his or her diabetes? Or if they find their efforts to change things that they don't like are ineffective, or if they handle well with respect to their diabetes, or they are able to manage things related to diabetes as well as most other people, or they succeed in projects they undertake to manage their diabetes, or their plans for managing diabetes don't work out well, or however, how hard they try, managing diabetes doesn't turn out the way they would like. And the last question is whether they are able to accomplish their goals with respect to managing their diabetes. Next is an example of action plan. So it includes what, when, where, and how much. So action plan, it teaches the participants to divide their task into more doable and achievable subject and steps. And this is the example of making lifestyle changes. And this project was funded by Canadian Institute of Health Research. And the principal investigator were Patrick McGowan, and co-principal investigator was Scott, Cheyenne, and Jay. And the project staff was Helena, and industry partners were Michael Ferguson and Brian, and community partners were Raminder Kang, Raminder Kaur, Harbinder Bals, Kamal, and Inderjeet. And for the smartphone app information and to get help in downloading these, please contact me. And these are the contact information.
Okay, so I guess now we'll look at some of the promotional activities we used to try to disseminate this app so far. And to be honest, it's been very difficult with COVID. Okay, we've tried numerous things, the same strategies that we had tried in the past with our other programs, which seem to work well, but don't seem to work. We use social media, we use radio shows, TV shows, newspaper ads, notices in temples and shopping malls and everything else. And we haven't been very successful so far because sort of the bottom line is, I believe that this would work best if a health professional would just give it to the person they're seeing, like a doctor or a nurse or a diabetes educator, and say, contact Gundeep. And she'll explain everything, and that would be the best way of doing it. Some of the lessons we learned, okay? Now, when we started, we understood that the educational level and ability to people to read and even write in the Punjabi language was variable. So we chose to make it so that people could read it. We kept the language quite straightforward and not too complex and in certain size. And also we had it voice made so that people can actually just listen to it if they can't read, okay? We did decide to work with our older Punjabi population that we've been involved with over the years. I think at this time, I'd say that perhaps that wasn't a good strategy. Maybe it's a better strategy to start off with younger people and then have it sort of go through the generations in the family, okay? We had an assumption about smartphones as well. At the first, we believed that people that had smartphones that would be able to handle an app. As it turned out, they didn't, okay? When we had big gets together, let's say 40 people would come to want the app installed on their phone, everybody had, they look like hand-me-down older phones that probably been through family and friends, members, whatnot, and people didn't know how to text and didn't receive email on the phones. There was just a telephone, okay? Another thing was we made sure that the installation process had to be simple. That's why Gundeep is our contact person with the installation process, and people call her, and Gundeep just walks the person through very, very, very quickly. And probably the last lesson learned was it's not just an app. We looked at apps, and I said there's thousands and thousands, but in the literature review we did, there was very little evidence showing effectiveness of these diabetes apps in helping people make behavioral life changes and dealing with diabetes. The app is now part of a program, okay? A program that Gundeep explained. People speak with Gundeep. Gundeep guides them through 3 different times, and then weekly group meetings by conference call that Gundeep facilitates. So I guess we're finished there, and I guess over to Krista.
Thank you, guys. I'm looking really forward to chatting with you about this. And thank you to everybody for coming out today. I want to let people know if you do have questions, please do put them into the chat box and I will include those. But I also have some questions of my own. And the first one is a really basic one, which is, what was it that inspired you to try an app in the first place? Why did you decide to go with the app?
Okay, well, it was that the only way we're able to provide programs in this community were in-person group programs. And then remember, all these people are at-risk population. So there was no personal contact. So we have to think of virtual ways of doing things. Of course, we're trying virtual Zoom meetings, everything as well. But this was one that seemed to be suggested by the community, and believe it or not, even the university studying IT, that it would be a very feasible thing. And I still think it's feasible, just we haven't worked out the bugs yet.
Absolutely. And someone just asked if there are flyers or things that they can give out to their patients that you can share with us. So maybe if that's something that we can give out.
Yes, we will send you via email. We have brochures for app program and other programs as well.
Perfect. So we'll make sure that people that are attending have access to get those. And so my next question will be really, you guys worked a lot with the community to develop this, which I think is really critical. And so I wanted to ask how you felt that the community participation really helped you to frame this project.
Well, again, the whole input we got for what they thought would be valuable in an app came from like 59 people who attended 4 focus groups. And then our community partners, they were sort of looking at them as sort of expert community members as well with their perspective. We couldn't have done that on our own. So, I mean, they guided us through what we should be doing. So, and they were very open to the idea of an app on their smartphones.
Yeah, and it's an amazing process, I think. And one of the questions that came to me while I was watching this is there's a lot of caregivers or children of people where English is not their first language who go to appointments with their family, appointments with their parents, especially relating to diabetes. Is there a way for them to interact with this app as well? Or were they included in the design process? I just wonder about the caregiver side of things.
Okay. Well, basically, it was adults, older adults with type 2 diabetes who speak mostly Punjabi. Okay? I mean, they could speak English as well, but Punjabi. So we sort of had that in the back of our mind when we developed it. Now, younger people could use the app as well. They wouldn't have any trouble reading the information because it was straightforward. And by the way, those educational presentations that Gandeep spoke about, in the app, there's references that people can click, hyperlinks to, and there's also videos they can watch on it. But we just wanted to provide enough information to make sure people got the picture, but not overwhelm them. They can go further if they want, but this is sort of a starting point. So I think younger people can certainly, but it's basically focused on type 2 diabetes.
Amazing. And one of the questions that we're getting from a lot of the participants is whether it's also available in English. So is there a translated version as well?
No.
It's only in Punjabi.
Only in Punjabi. It's interesting. When we were developing the app, the developer made a prototype version for development, and it had English and Punjabi. So both, So that was great because I could read it and I can understand it. But now it's only in Punjabi and I can't understand the thing. Thank goodness for Gandeep here.
Wonderful. And so with that said, was there any consideration that you'll do these in other languages if this is successful?
Well, if this is successful, there could be a potential, yes. I mean, it depends on, when you do research and everything else, you want to see some results first. And if it's really, really promising, then there's a potential of going further. If it's like, if we find out it's just too hard to implement, then that sort of puts a damper on things. But certainly, if it does prove to be implementable in an easy way and that the uptake is really, really high, then of course, we'll probably go on, yeah.
Wonderful. And Gandeep, I wanted to ask you about some of the questions that people have when they call you to sign up. Are there things that come up again and again with people as they try to learn how to use the app?
Yes, the main shortcoming that we are finding is the people don't have email address. Then first we have to create an email address for them, and then we have to look for all the other requirements, like they have the latest smartphone, and then I will walk them through the download steps on the phone.
So you're definitely finding that there's a technology gap in terms of users.
Yeah.
And a question just came in from the audience about the patient information that's collected through the app. So is that being used anywhere else in terms of research or in other places at all? Or is it just something that goes into the app?
No, I I don't think so. It's just for the betterment of the patient
Yeah.
care. And
Yeah.
there is a confidential agreement and the privacy policy. They agree to it, only then the information is collected.
Perfect. No, that's good to know.
And the information that's in the app, the presentations, whatnot, is this basically the same information that would be in the patient handbook that's delivered by the Vancouver Coastal Health and Providence Healthcare and even Fraser Health diabetes patient education booklet.
Excellent. And I know that this is obviously a research project, and I'm sure a lot of the people here are from the research community. Would you have anything that they could take away as learnings if they're also working with this community and looking for ways to create resources that would help them better manage their diabetes?
Certainly, certainly. Number one is I can share the whole process step by step of how we developed the app. Okay. The second thing is right now we have the app sitting in the University of Victoria, just waiting to be used. As we said, it can be 50,000, 100,000 people using it once. Okay. We are only enrolling people into the program that Gandeep explained, where they have the telephone calls from her and also the weekly programs for people in British Columbia. But I don't see any reason why people across Canada can't use the app as well. Now, the second thing is we have the app sitting there. We've done a bit of evaluation with it so far, but it hasn't gone through a thorough evaluation yet. If there's any researchers out there that are really interested in IT who would love to get into the fold here and join us to do an evaluation, a succinct evaluation, then that would be really helpful. So definitely opportunity.
Wonderful. And I guess also I will ask you sort of as a follow-up about the Ministry of Health and UVic are involved with this. So when people are asking questions about data, they are involved in the data collection in terms of the safety and efficacy, I'm assuming?
Mm-hmm. Yeah, sure. Yep.
Perfect. And Gandeep, I think this is a question for you because the question is, when do they receive the enrollment code when they first sign up? Is it via email or could it be through the phone?
Oh, it will be on the phone. When I contact them for the first time, I will make sure that their phone is latest edition, and then I will give them the code. And it's unique to every person. So once you signed up, your email is registered with the account, and you can't use the same email or another account.
Okay, so that's really great. And another question that came in is, could the person use a computer or does it have to be a mobile device? So I think that answers that.
Yes.
Mm-hmm.
All right, I have another account setup question. So I'll ask this. So during account setup, can a participant select more than one problem to base their action plan around? The person who wrote this, Selma, said that she thinks it would be a helpful option.
So we prefer, and in the app, it's like you can only select one problem to work on, but it gives you an option to modify that problem. So you can modify or change your action plan, but basically it's just on one problem to begin with. Yeah,
one problem at a time. A person can go on and come up with as many problems as they want help with, but working on at one time, one problem at a time.
Wonderful. And the next question that's come in is from Ananya Banerjee, and she is wondering if patients can monitor their sugar levels and link it to their exercise and food patterns so they can see trends to keep them engaged in the app.
No, we didn't include monitoring sugar levels as part of this app. This was more of a patient education app that had a theoretical behavior change approach to it. So,
but if they prefer to monitor their blood level, they can do it separately, and they can make an action plan on exercise, and they can correlate whether it affects the sugar level or not. But monitoring is not included in the app.
Yeah. Specifically, I'll add to that is when we reviewed the literature, most apps just monitored blood sugar levels. So a person knows their blood sugar levels. So what are they going to do with that? Or in some apps, made that information available to the family doctor. So then the doctor gets it and says, Patrick, you got to change your behavior here. This wasn't the app we wanted. We wanted a patient education where people actually learned about diabetes, type 2 diabetes, and learned some things they could do to manage it. And that was the whole essence of the app.
Yeah, it's really interesting because it reminds me of when they were developing the Band app and different apps that really have, your blood sugar monitoring, but those were really focused on type 1. So it's kind of great to have an option where maybe there could be collaborations to work together with different apps and to combine the resources. And I know that your app has a lot of nudges and reminders and things like that. How are people reacting to those? Are they helpful?
Oh, yes. So every week it gives you the notification. It's just like an alarm or reminder. So you can go and complete your action plan. You can go read what you want to read or cover in the week. And this is really helpful.
Yeah. And to add to that is when we did our user test, that's something that people commented on. They like being nudged and reminded it's time for it. They sort of came into a habit, and at 5 o'clock at night, it goes off and, oh, that's the diabetes app asking me how I'm doing. So, yeah.
Wonderful. And we have another question from a participant who's asking, is there a way to download health reports that you can take with you to your doctor or things that you can monitor over time, or is it all kept in the app?
I don't think we do have health reports, collected information in the app. There's very, very little specific medical information that's included in the app. Maybe just your name, what your diagnosis date.
And action plan.
And action plans.
You can save those in the app. And if you read some topic and they do ask you, like, do you know about it before? Or did you learn something? And would you like to add in the column what you learned? So these kind of information the app is saving.
Mm-hmm.
But you can't download any report.
Okay, but I think that just because that made me think of something else in terms of, like, if you're going into your doctor's office and maybe you're going with your child or with someone to help you with the language barrier, this could actually provide some really interesting information that you could talk to your whomever is going with you to the doctor to make sure that some of the things that you're encountering, they could be discussing at your appointment, which would be really helpful, I would think, especially if you're trying to navigate.
Certainly a person could speak to a doctor and say, yes, I do. I walk now because I made an action plan. Doctor says, what's an action plan? Well, I learned that in the app, I learned to make a difficult decision, I know how to problem solve now when I'm having trouble with my glucose level, So that's the kind of information they share with the doctors.
Amazing. And so which age group are you finding is mostly enrolled so far?
Well, we've had a little bit of experience in user tests and whatnot, like only limited evaluation, but it seems to work best in a little bit younger population, okay? And especially with his family involved.
Yes.
Because there's a lot of dynamics in communication in family. And if Granny is having trouble loading it, then the grandson comes along and says, here, I'll do it for you, Granny. And there we go, So as initially it was supposed to be for this older population, people experience type 2 diabetes. But as we're saying, it's more productive, we believe, if it's a little bit younger population as well, and people in the family.
Right. And we have another question that's come in BC health authorities who have many South Asian clients. It'll be interesting to hear of their perspectives on the integration into the programs they offer. Do you have any thoughts?
Well, again, that's part of our probably potential dissemination plan. Again, just as we're doing a webinar today, which is fantastic for people hearing about it, it'll be really productive if Vancouver Island or northern communities or the interior would have the same kind of information sharing activities.
And another question, in terms of, obviously language was a big factor in developing that. Were there any other cultural considerations that came into play when you were developing the app?
Well, we have to be very careful with cultural considerations because that's where our community tells us, our community members tell us what's appropriate and what's not appropriate. Many, many years ago, when we first started implementing the in-person programs, we went to health professionals and said, oh no, you can't do it with men and women at the same time. You have to do it separately and whatnot. They told us that, but the community said, no, we do it together. And I think in our whole experience in this whole community, there was only one activity, and it was quite a strict group that the women sat on one side and the men sat on the other side. That's all. So we're very careful with cultural suggestions. We listen to our community members and they tell us if it's like what their perspective is, how valid it is.
Wonderful. And those are all of our questions, unless someone else has anything. So we might get some time back today, which is always one of my favorite things about doing these, is if we can give you back a little bit of time. So I am going to throw over to Jeevan now.
Awesome. Thank you. Thank you, Patrick, Gundeep, and Krista today for sharing your guys' learnings and also showcasing this amazing new app. Before everybody else logs off, we do want to hear from you about the content of this session. You are shortly going to see a poll pop up with 4 statements we'd like you guys to respond to. Please do scroll down in the poll pop up to answer all 4 of the statements. I'm just going to give you guys a few seconds to read through and answer those. While you guys are answering those polls, just want to let you know that your real-time feedback through this Zoom poll and the feedback that we will receive from the follow-up survey that we're going to send after this session, and we will drop this into the chat as well, will help us adjust and design future webinars. We do our best to respond to your guys' comments and suggestions to make these sessions as tangible and relevant as possible for you guys. I will also like you guys to please join the Type 2 Diabetes Network. We'll drop the link into the chat if you haven't already, to stay up to date with all the latest newsletters that we send out monthly, the upcoming webinars, and we do have a really great set of webinars planned for this year, and to stay in the know for the community resources and events that are happening in Type 2 diabetes. And if anybody has any other last minute questions or comments for any of our panelists today, please let us know. Otherwise, like Krista said, it's always nice to have some time back. So thank you guys for taking out the time today to join us. Keep well and stay safe.